I think we're going to go ahead and get started. My name is Derek Griffith. I'm one of the co-directors and co-founders of the Racial Justice Institute. Also here actually, let me first introduce also our executive director, Diane Rush-Turney, who was certainly behind the big part of this for us. And so thank you very much. I want to make sure we publicly thank you for all that you do. We'll introduce the rest of the panel. Yes, please. People behind the scenes never get enough credit, so thank you. And I don't see the other folks from O'Neill, but, oh, there you are. Yes, there you go. Sorry, I know Andy's here, and Bethany's back there, so thank you to, oh, there we go. Thank you for that too. So we made a slight modification, as you can see. Unfortunately, one of our panelists was unable to join us, but we have actually doubled the replacement. So we have Andy joining us, and then we also have Ngozi joining us. We'll get into more formal introductions in just a minute. But I didn't want to miss the opportunity for them to be able to join us since they're actually here.
I would just moderate the questions with the audience. Just in case you were expecting my contribution, Mr. Flores.
We'll work it out. So what we're going to do first, again, let me say first, thank you and welcome. We're very excited to have this event. This is actually our first really public event from the Racial Justice Institute. And we're very excited to be partnering with the O'Neill Institute to do this event. So thank you again for your interest and willingness to collaborate on this event. So what we're going to do in terms of the run of the show is just do a brief overview introduction to the Racial Justice Institute. Also have Dr. T and Ngozi present a little bit about the commission and the work that they're doing. Andy, and you can talk a little bit about O'Neill and so forth. And then we'll have some scripted questions and then open it up for Q&A. So let me first just walk through a couple of slides. Oops, I had it at the very end. Stealing my own thunder here. Okay, so this is, again, just the opening of, we framed us in terms of Sankofa. Sankofa is a Ghanaian concept and image that reflects basically a couple of basic things. Often in Sankofa, one of the key parts of it is the bird is facing forward and is trying to move forward in time and context and history and agenda. Is holding an egg often, and that is showing that you have to, if you think about holding an egg, you have to hold it firmly enough that it won't drop, but not firmly enough, but not so firmly that you break it. So there's a balancing of thinking about the future that you have to recognize that you have to how to hold it, connect it with it, but not sort of overvalue and undervalue it in that context. But then also the bird is looking backwards to make sure that it can capture what's happened in the past and understand adequately what's happened in the past, but the bird is clearly facing forward, and so it's really trying to move forward into the future. So we started there with this concept for the Racial Justice Institute, and in this particular presentation, because of the history out of which we emerged. The Racial Justice Institute is really coming out of the history of Georgetown's acknowledgement of its selling of the 272 slaves. And it was really, we are the forward part of this. They are making efforts to deal with the looking backwards and the reparations and those things to the family, to the community, to the history, and so forth. But we are the part that's really leading the effort going forward of how do we prevent this from things like this from happening again? How do we mitigate the effects of these kinds of things that are happening now? And how do we move forward into the future? Oh. I stole all that. So our focus, we have a lot of topical areas. I'm not going to go through these in essential detail, but they're all, as you can imagine, interconnected. If you think about the ideas of racial equity and the barriers to racial equity, that health and well-being, education, wealth, economic security, violence, police violence, safety, and so forth, all of these things are very much interconnected and intertwined. And so we are recognizing that we have to be holistic in our approach to dealing with and thinking about the factors associated with racial justice. And so our goal is to really be a hub, to be that node around which we can organize the campus community, the networks within Georgetown, networks within DC, nationally and globally. And so that's why this global partnership is such an important component of this, that we're building from the natural capacity and the strengths of two entities that are connected to Georgetown, but definitely have an explicit global focus. And so it's really thinking about, if you think about some of the challenges we have, we've been trying to do this work on equity, you could say since there have been inequities, but certainly in the United States context, for, let's say, 100 plus years. And you can argue about how much progress we've made, but there's certainly a lot more progress to be made. The point is that we need to stimulate and come up with, be imaginative about how we're going to move forward. We have to figure out how we're going to stimulate new ideas, new approaches to doing this work, and that's where we are come together from 4 different disciplines: health, law, policy, and performing arts / African American studies. I know that's 5, but just work with me. She embodies 2, so we've got a lot of this dual work here. And so it's really about, again, sort of bring that hub to connect with folks, to be able to bring together ideas and people and perspectives that have not been brought together before, to seed and inspire the next generation, and then to, again, be that intellectual node around which we can build this work. We want to, again, develop, we're trying not to do science just for the sake of science or study things just for the sake of them. We really want to make sure that the work we do actually has an explicit attention to moving forward, excuse me, as the Sankofa bird that we were talking about initially suggests, that we are trying to move forward in the work. It's not just studying science for the sake of science. So some of the initiatives that we have is we really want to do, this is the first of multiple conversations that we will have. They will not necessarily just be this small, but we wanted to start with you hearing from leaders in this space. But we really want to have a multidisciplinary, university-wide conversation in this about racial justice. What is it? When we think about racial justice, are we only talking about race? Race clearly is not a concept that is universally and globally recognized. There are similar issues around structural context and structural factors that lead to inequality or associated with that we also need to think about. How do those factor into this? How do other intersections of identities and structures factor into the work that we do? So we're trying to have some conversations about what those things are and what is our role in this work. We'll do a university-wide symposium to bring in external speakers for that work as well. And again, to really stimulate new ideas, new approaches, and to critique some of the work that has been done thus far. Thinking about other public lectures, so if you have ideas of folks that you'd want to hear from, please let us know. Or actually, please let Diane know, because all we're going to do is go tell Diane. But that we want to, again, bring in people who will provoke, again, new ways of thinking, new approaches, new ways of addressing these kinds of issues, and then develop potential smart projects and other sort of pilot things to be able to stimulate new ideas and relationships that we have within the network and community that we're building here. And then last working to build research centers, or again, more natural and more enduring relationships among faculty, staff, and students to be able to do some of the work to really have these ideas begin to grow and be able to create replicable models for meaningful change. So these are us. And we have a 4th that is coming that they haven't officially announced, so I won't say much more about her other than that. Other than, obviously, I've given away at least some part of it. And I'm being in trouble, as you can tell, so that's why Anita's looking at me like, oh, I wasn't supposed to say more. Yes, the policy person is, so we've given 2 things away. We've given her gender identity, and we've given away that she's from the School of Policy. That's as much of a teaser as I can give you. So what we're going to quickly do is just walk through a little bit of the work of the 3 initial centers that we have within the Racial Justice Institute that are really the engines through which a lot of these new ideas are really starting to develop. So I will start, just because I already had the mic, with my Center for Men's Health Equity. And then we'll have, Anita and then Robin go forward from there. So quickly, since I came, I've had this Center for Men's Health Equity. It's really an effort to think about how do we need to improve health and well-being at a higher scale. And the way that of course, the first question I often get when I say I do men's health equity is, why would you study men? Why would you study men's health? What the heck? Don't we have enough? Like, do we really need this? Yeah, you're already laughing. See, you're starting. So the answer is because despite men's advantages in every structural aspect of society, men live shorter lives than women. Men live shorter lives than others of other gender identities and so forth. The question is why? And what do we do about that? And is it only because men don't like to follow directions, ask for support, do all that kind of stuff? Or is there something more potentially to it? There's that and potentially other things. So, and that's not a universal, the health connection to those structural sort of beliefs, values, the opportunities or lack thereof that are within there are not universally benefiting all groups of men. So you still see among groups of men very significant differences in health profile and life expectancy and other key indicators of health among groups of men, again, in the U.S. and globally. And so we've been trying to do a lot more of that work, both here in the U.S. as well as globally, and really thinking about how do we think about policy and practices at that level in those spaces. So what are national policies? There are now, I think, 9 countries that have national men's health policies, for example, that are really trying to think about how do you address these kinds of issues at a national level. The reason that becomes important is because if you think about what's driving poor health, it's, again, not something where you can just look at a particular group and just say that they're all equally, having the same health profile. You have to look at subgroups and who's actually driving that. And unfortunately, men in some combination of other structural identities are usually the ones who are at the bottom when it comes to health profile, despite their structural advantages. So the way that I talk about it is I'm trying to center the margins, if you will, sort of borrowing from intersectionality, critical race theory, and so forth, of health equity that doesn't tend to really deal explicitly with gender, at least gender as it relates to males, and the men's health work that doesn't tend to really look at diversity among men. So to that, let me pass it off to Dr. Gonzalez.
Hello, thank you all for coming. It's really lovely to see all of your faces in here. The center that I formed coming here and thinking about how racial justice can best be enacted is the Woodshed, which is a Center for Art, Thought, and Culture. What I represent is not just the theater and but also the humanities. And also I'm connected with Georgetown College, which you know is the undergraduate component of Georgetown University. So the Woodshed tries to use arts as a way of inspiring conversations and activist methodologies. We use the arts as a centerpiece for talking about some of the core issues of racial justice. I often say that we're the public face of what racial justice looks like, and we use forms that invoke empathy in people in order to have them really understand the impact that racial injustice has upon living human beings. And that is, in fact, what I also think the humanities do in addition to the arts. So we have conversations that are based around performances. We have community engagements where we try to get feedback from community members about what their response is to the issues. I know many of you may have heard of the idea of playback theater, for example, where you present an issue and then the audience responds and says what they would do to solve the issue. Those are the kinds of public conversations that we do. In the 2 years that I've been involved with the Racial Justice Institute, we've done some work with local Washington, D.C. communities talking about women and survival, economic survival. We've done some work with indigenous communities talking about violence against murdered women. We've done some international work both with the Black communities of Liverpool and most recently in South Africa. We've taken a cohort of scholars to work with people from the Wits University in order to really figure out what community engagement looks like. So instead, we used WITS as a springboard for going into the townships themselves to talk with other community centers or using the arts as a platform for trying to make change in economic disparity, in health, and especially in mental health. I'm finding as I continue to do this work that the arts really can touch on mental health in ways that other vehicles do not. because people are responding to sounds and gestures, textures and colors, and also connecting to community and many other intersectional identities. So that's the work that the Woodshed has been doing here at the Racial Justice Institute.
Thank you. Last but not least, at least for us, Dr. Lenhart, or Robin Lenhart.
Thank you. I was going to say I didn't actually earn the doctor part. I'm a lawyer. Can you hear it now? Okay. Sorry about that. So I come from a sort of different approach when it comes to the work that we're doing, that I've been doing at the Racial Justice Institute. I started my sort of journey in thinking about race and inequality and how we move the needle on that way back when I was in college. And I'm really thinking hard about what intervention can I make, right? What difference can I make? Back then, when I was young, I thought I could do a lot of things. I meant to be successful in some, but in many ways, that sort of effort to figure out what works best, what can most be the change the needle in ways that are important, or things that I'm still thinking through. I started my career as a young lawyer, and I worked with an organization here in town that focused on a number of issues. In particular, the work that I did there had to do with the same issue that the Supreme Court is dealing with right now, how do we think about issues of race? How do we think about inclusion? How do we allow equity for all people? I left that organization not because it wasn't one that was successful. It's been tremendously successful, but because in lots of ways it wasn't answering or giving me the answers that I wanted. A sense of where I could intervene and have a real impact. I ended up going to working at the Justice Department for a while, and then I worked with an incredible civil rights leader, John Payton, who was also a leader in the cases involving Michigan. I worked on that with him. And it was after that time, the years that I spent with him, that I realized that I needed to come back to my roots as a student, as somebody who could learn and begin to offer different ways of thinking about our communities, our solutions, things that are working and that are not working. And that sort of brought me here to Georgetown. The opportunity, the dean here used to be my mentor, and he said, hey, what do you think about coming to Georgetown? There are lots of things that you can do. And what I realized is that I wanted to really try to engage structural racial inequality in a meaningful way, in a way that wasn't just for academics who had lofty ideas about what they thought should be happening, but created spaces for people in communities to be their own pathway for change. And I didn't pass my slides along, but I can tell you that after working on a number of projects the last couple years here, including some that dealt with police violence, that had to do with reparations, what I sort of settled on is a project that tries to get at structural racial inequality and its impact by not just having a quote-unquote expert, but bringing together people who are in community, who are trying to move the needle in an important way. That's not to say that as part of this project, which I call the race audit, is really about bringing people and the knowledge and the personal understandings that they have because of their work, that we can work together to make real change. So the race audit imagines community meters. Today I'm not speaking properly, but community members who come together and say, look, we're going to try to figure out why our community looks the way it does and what we can do about it. So that means we've got wonderful experts like my colleagues, but we also have grandmothers, we have teachers in communities, we have religious leaders, we have people who come together and together come up with a solution that can be useful. So I have more to say, but I'll stop with that and just say that I continue to be that young person who's looking for a way to make a change, and I think race audits might be a way for.
Thank you. So as we transition to the O'Neill team, let me at least introduce names and then I'll let you all take it from there. So first, Dr. Talang Bofa-King is, did I do that right? Thank you. Okay. Is the UN Special Rapporteur on the Right to Health and from the Office of the High Commissioner for Human Rights. She's also co-chair of the O'Neill-Lancet Commission on Racism, Structural Discrimination, and Global Health. Her, as I would say, partner in crime, Dr. Ngozi Arundu, is also the co-chair of the O'Neill-Lancet Commission on Racism, Structural Discrimination, and Global Health, and is also a distinguished lecturer, senior scholar, here at O'Neill and at Georgetown. And third, not last but not least, Andy Constantin is also here at O'Neill as a director of, thank you, of the O'Neill Institute. So I will let you all take it away from here. So thank you.
Thank you, Derek. I just want to start by thanking all of you for joining us tonight. It is truly inspiring to see all of our students and all of you, honestly, joining us on a Friday night for this very important conversation. I think it gives us all hope for the future. So thank you for taking the time to join us. And thank you to the Racial Justice Institute and to Diane in particular for all your help in organizing this event. I just want to briefly share a bit about the O'Neill Institute, who we are and what we do. We are located here at Georgetown University Law Center. We have a beautiful office in a remodeled building next to this one. The Institute was created in 2007 out of the generous philanthropy of the O'Neill family. It's a beautiful story, actually. Linda O'Neill, she studied at the School of Medicine, and Tim O'Neill studied at the School of Law, so they thought it would be appropriate and important to create an institute that can work at the intersection of health law and policy, and that's what we've been doing for the last 15 years. We've been contributing to national and global health law all around the world. We have different projects in different countries. We work with partners in all regions of the world at the moment, and as part of that effort to promote and to use the law as a tool to promote healthier lives, we have partnered with the Lancet to create the Lancet O'Neill Commission on Structural Racism and Health that I hope Dr. T and Ngozi can share a bit more. But I just wanted to say those few words. Sadly, our panelist, Silvia Serrano, couldn't join us tonight. She had a medical emergency last minute. So I'm here to represent the O'Neill Institute jointly with Ngozi and Dr. T. And now I give the floor to you. Thank you.
Hi, everyone. Thank you so much for being here. I must just tell you that I'm severely jet lagged. I've just put my feet on the ground, literally, a few hours ago. But nonetheless, I think, the story of racial justice, and I suppose for me, ultimately, freedom, is riddled with these little individual stories of what we often call resilience, and I am in a space now where I'm constantly asking myself how much of individual responsibility we place on people to face systemic structural issues that are historical and have ongoing buy-in and support, right, of harmful systems. And that's sort of the space where I'm at personally at the moment. And that personal politics reflects in my own work at the UN as a special rapporteur on the right to health. As initially I had, of course, as we all do when we come into the role, you get on a call with a couple of supporters of the mandate, friends of the mandate, people who've been supporting your predecessors to then share your vision. And my vision was very clear: anti-racist, anti-colonial, using intersectional approaches going forward. And everybody ran away. And so that started the story and my relationship formally with O'Neill Institute and Georgetown, because they're the ones who stayed. And it was very meaningful, especially in that point, having been appointed the first Black person in that role, but also the first woman, and then also from Africa. So there's a lot that you could just pick out in terms of poetic way, right? Nothing too deep, but also there's a lot of deepness and lots of things that you can really reflect upon there. And last year at the General Assembly, I presented a report on racism and the right to health, making a point that racism, it's not a question whether it's a determinant of health or not. I'm asserting and underscoring that it is. And with that understanding, how do we then analyze the world and health outcomes and indicators? And at the time, I was motivated by the 2030 agenda and this move to this post-COVID world, which just simply is not existing, but people are creating a post-COVID world that again will be leaving people behind, this very same people that were left behind during the acute phase of the pandemic response. And so you would wonder, what does a woman like me from Johannesburg have to do with, important spaces like Georgetown? The simple answer is that the expertise of the people to solve the problems they have are already within them. We don't need saving from anybody. And in fact, with Roe v. Wade, I often reflect on that case and think, if more of our colleagues were open to learning and being on the floor, that talking about the grandmothers, we sit on the floor and we listen to the grandmothers talk and get that strategy and get those learnings. How far would things have happened in the previous administration, and how far would the things have moved if our default setting is that we also have things to learn from other activists in the so-called global south, and not only looking at knowledge as just only being a currency that's credible only coming from the global north, and therefore everything gets exported to the global south. And many of us have been, and as a doctor, I've been dealing with the issue of the global gag rule, for example, as a foreign policy. And I've been warning my colleagues that it's only a matter of time until that foreign policy becomes domestic policy. And it took only a matter of 4 years for that to happen. And so those are just sort of my background, my history, the things that moves me, the things that I'm constantly thinking about in the world. And I'm going to leave Ngozi to do the hard work of telling you about the commission. But the commission is important because it takes so as a mandate holder at the UN, you are tasked with doing an annual report, a thematic report for the Human Rights Council and one for the General Assembly. The work is really, really important, but it's also limiting in many ways. There are just particular things I can't say in 25,000 words, right? And so I wanted the work to find meaning, to find resonance, but to also grow outside of those UN spaces, which are themselves exclusionary, just by default. And that's why the work with O'Neill, for me, as people who support the mandate, but also the people who are now key stakeholders with this Lancet Commission, is so important to make sure that the issue of racism and not race is understood to be the underlying determinant of health. And that in fact, it's not just about access to facilities when you are sick, but it's also about the underlying determinants of health. And that's where a lot of the structural discrimination the transphobia and the homophobia, the sexism, the misogyny, the harmful stereotypes about Black women not feeling pain, and and how that then looks like in terms of maternal mortality outcomes within health facilities. Those are important threads for me. And again, really because of having been a doctor in South Africa, who herself was not taught human rights, by the way, in my undergraduate curriculum. And the question constantly now is, to what extent is the medical curriculum around the world, but even Georgetown Medical School curriculum, to what extent is medical curriculum enabling us as doctors, as healthcare workers, as practitioners to be protectors of human rights? And the answer is for another panel. Thank you.
Before you hand the mic over, could you just answer, I know this is a little out of the order of what I was supposed to do, but can you talk about, for the UN report that you did, you used a legal framework to underlie your argument for why you needed to address racism. So I wanted, just because of O'Neill, we have law scholars here, to just briefly touch on that before we hand it over to Dr. O'Neill.
Oh, of course. And there's a few examples we can do, but for example, we have a case now in the Court of European Human Rights that involves Caster Semenya, who's a runner in South Africa, an elite sport runner. And because she beat someone in a track race who had come last anyway, so even if Caster was not there, she wouldn't have won anyway, but she cried. And of course, we know the fragility of white women's tears mean a lot of things. And when you are saying someone that looks like Caster Semenya, who doesn't embody the kind of femininity that the world values, it means particular things. And so because of that incident, started the whole entire issue that started as gossip and then escalated to real institutional violence. And I'm giving you that example because often people will talk about the rules, the law, the policy. And to what extent is the law, the policy, the rules actually protecting rights or an enabler of violence? And that's really the question that I was asking in the report, to say, also being a South African, apartheid in South Africa was legislated. When I was a child, I was living in a country that made it legal for violence to be, happening onto me. And there was no recourse. And so it's also this idea that even when things do go wrong, even if we wanted to pretend like things are equal, for some people there's no recourse when things go wrong. And that's another element, again, on the right to health in terms of accountability. Because human rights is the language of obligations on member states. So it's about how do we hold them accountable for when then things go wrong, when rights gets violated. But the use of the law as a tool to advance human rights violations is something that, in the mandate at least, I found that had not been, or at least analyzed in the ways of the anti-racism, anti-colonial lens. Something really simple. I spoke about the global gag. That's a form of a regulation. If you get this particular money for anything in your community, that doesn't even have to do with health. But as a doctor, I'm then expected to not practice ethical medicine by withholding information, by not referring, by not supporting advocacy or even building movements with my colleagues, and I'm not supposed to perform abortion. So if we were in South Africa, I could not be on this panel. And that is a problem, and that is because of the regulation, the contract, the law. And I wanted us to interrogate deeper. Can we just accept the law as neutral? I know for sure that it's not, just because of my lived experience. But I also wanted to talk about this idea of epistemic injustice, because often when then people who are racialized in particular ways, who experience structural discrimination in particular ways, those people in which power moves through them in different ways, the system gaslights us, right? It's you, just pull yourself by the bootstraps, work harder, focus on schools, forget boys, just work hard. It's not just about working harder. If it was about working harder, Black women will be the most wealthiest people in the planet, and we are the poorest, right? And that's why, sorry, Derek, you didn't ask me this, but the coming report is on food and the right to health. It's important to talk about the health of populations, but talk about the fact that the people who produce and work the land that feeds us every day is Black women, but they don't have access to land. They don't have rights to land. They don't have the means of production. we still die from preventable diseases. And so the climate crisis and how we understand it, without a gendered racial lens, we are still going to leave people behind. And so that's why it was important to do that report first of racism and just say we're not having it's not a Q&A whether racism is a determinant of health. I'm saying it is. We know it is. There's enough research to say it is. So if we can diagnose it properly, perhaps we can come with the proper diagnostics and then come up with a better plan. But the plan has to center the people whose lives are most impacted by these particular issues we are trying to solve.
Thank you.
Okay,
Yes, please.
it's a great way to start. By anything that Dr. T says, I can just go off of that. But hi everyone, I'm Ngozi Arandu. I'm an infectious disease epidemiologist by training, which is really interesting for me and Dr. T to be co-chairs of this commission because she's a medical doctor, but also an activist, like clearly. And then me having the background of population health and scholar activism in a different way, it was really cool to come together and kind of think about global health, but also health globally. And that's really what the commission is looking at, right? So when we talk about racism and structural discrimination, to what Derek said earlier, everyone's not using the word racism, but that doesn't mean that they're not being oppressed or there's not some specific communities or groups or sects within those countries that are not having disproportionate oppression. One thing that this commission wants to do is kind of knit together those stories and those experiences, right? So how is a Dalit person in India that has, structurally can only work in certain places, right? They're the only ones that can, for example, remove the pit latrine, right? Like remove the waste from the pit latrine. How does that impact we can already imagine how that impacts their lives, but just think about the generational trauma that causes. And then how does that link into maybe somebody from an urban community in Chicago and the oppression that they have or the generational struggles that they have because they're in a situation where they don't have access to quality education or, they live in a food desert or they also have limitations with regards to which occupation they have access to, right? So we're trying to understand these experiences, these cultures, these communities, but not just understand them. We really want to create a platform for visibility and for kind of co-creation of policy change through these communities. So we're not trying to go in there and say, we're the Commission on Racism and Structural Discrimination. These are the things that you need to do. No, we're trying, part of the commission strategy was to select commissioners that are embedded into communities, right? That are the ones that can actually go into communities through consultations, understand what the specific challenges that are going on, what specific structures are preventing them for, the outcome may be health in some ways, but it's so much more than health, as Dr. T was saying. What is stopping them from being free, right? So these are the kind of questions that we'll be asking through the commission. It's a 3-year commission. We really have about I would say 3 main activities. One is to diagnose the problem. So exactly what I'm talking about, diagnosing the problem around the world, globally. But realistically, there's 20 commissioners, so we're not going to be able to talk about every single ethnic group, every single queer identity. We're going to be able to reach the communities that are more proximate to our commissioners, but we're going to do our best to be as inclusive as possible, to ensure that we have consultations that are really open and far-reaching. Part of diagnosing the problem is also, though, identifying best practices. So part of the commission is actually looking for exemplars. So I'm actually quite tired too. I can feel myself sorry, we both flew from far, but she just came in. So I'm gonna take one for the team. So the exemplar work is really looking at, there are some, we kind of wishfully think that possibly we could find countries that could be exemplars, but realistically it might be a community or cities that are exemplars, that have health outcomes that are positive, that show reduction of disparities. We want to know, how did they get there? Now, if they decided to make certain economic choices and that ended up being, reducing breast cancer across all, ethnic groups in a one society. We don't think that's enough. We want to do a mixed method approach to speaking to policymakers as well as communities and understanding what intentional steps did you take to reduce disparities within this community or whatever unit of analysis. So we're really excited about that work as well, because I don't think you don't really hear that much about exemplars when it comes to anti-racism. So after we diagnose the problem, including the best practices, then it really is compiling this report that includes recommendations as well as, strategies, anti-racist strategies. But we also want to be very relevant, right? Like there are no general solutions, even though there might be threads of similarities, but there are huge human rights abuses happening right now. Like everyone probably knows about the Ugandan law that criminalizes same-sex. I think they call it the anti-homosexuality law. I think that's what they actually call it. But it has grave consequences, right? Like if you, what did they say, Ellen? If you actually identify as being gay, or you could actually be sentenced to prison for identifying. Is that like how do you even what does that even look like, right? And so we want to produce recommendations and findings that can be taken up by communities, taken up by groups to fight back, right? For specific contemporary issues in addition to kind of cross-cutting global issues as well. And then the last thing we want to do is really disseminate those findings and make sure that it gets back to the people who were able to co-create and to give us to help us shape the recommendations and the specific policy recommendations, I would say. So going back to the communities, but we really want to leverage Dr. T's exposure, visibility, and this, as she usually calls it, transient position of power, right? Like you're right now the UN Special Rapporteur on the right to health, and you have a very strong voice, whether you were the UN Special Rapporteur or not, but you have a strong voice and you're going to be in front of 100+ member states. And so it's important to use that position and be able to get countries to either commit or not commit. Like if you're not going to commit to anti-racist strategies and policies, tell us why. Tell the whole world why, right? I think this is a once-in-a-lifetime opportunity to have that level of influence. But it's not just the UN or communities. There's a lot of levels in between. And so we plan on doing a decentralized dissemination. We have commissioners from the UK, from South Africa, from India, from Sri Lanka, thank you, yeah, Australia. We're looking at indigenous rights. We're looking at gender and gender nonconforming issues and oppression. We're looking at sexual reproductive health rights. We're looking at health system access, and we're looking at I think we also have very high level areas that we're going to dig a bit deeper in. So if you think about kind of the racist response in COVID-19, like what does that look like when you look at crises in general, like whether it be pandemics or it be climate change? Like how can we examine that through a lens of intersectionality, but also anti-racist strategies? When we think about financing health systems and financing this massive industry of development and donor aid, what does that look like and how does that affect countries and communities? And then what's the other one? I'm trying to think of the last word group. The data? Yes, thank you. We actually have this area that we're thinking of, we call it new spaces for racism, right? It's Twitter, it's online, it's data, the use of data, it's big data, it's so whatever, racists will find a way to be racist. So we're also trying to include that as well. So I think that's pretty much the commission. Yeah. If you have any questions, let us know.
Thank you. So actually, let me start with somewhere near the end of what you were just saying. In terms of, you started with, one of the last points you made about dissemination was that you were co-creating with the community. And one of the things I want to tie it to is something that I think is a theme that cut across all of the presentations, is that some people make the mistake, not you, make the mistake of approaching efforts to address racism using a deficit lens. And all of you have talked about the idea that you want to build from community with community, recognizing that these spaces, these people have a wealth of strengths, a wealth of assets, and so forth. So I wanted you to just talk about each of you, how your work builds on people's assets, strengths, arts, culture, those who have been the objects of racism, to inform your efforts and to advance this work. So whoever wants to start.
I was very happy to hear you talk about how you listen to the grandmothers, right? I think that the academy tends to have, and you alluded to the fact that the academy tends to go down to save people when the community itself does have the answers. And I think that we need to develop new methodologies and strategies for getting the answers out of the community and have it impact the way that we develop our own research models. And so I think that in the arts, we use the vehicle of storytelling, but there are other ways of getting people to come together in focus groups and contribute to the knowledge base so that we can learn from the community members themselves. And I think that that is something that we hope to do in my center, but I think we're all working on the same square to do the same thing, right? To be able to find out how these stories can impact legal strategies, how they can impact the way that we develop health systems that may already exist in the communities and could be expanded upon so that we can help to all reach this common goal.
Okay, so, and that's a good question because I found it quite difficult to translate human rights, which are quite abstract and solid and rigid, into that, right? Into very tangible, emotive, personal experiences, because often in the policy-making legislative spaces, we tend to want to remove the person. And the far removed you are from that experience, the more expert-like you look, you know? And so I've been very intentional in how I write my reports as well, but also in how those consultations happen. And it's something that we will be infusing very intentionally in the commission because the process of the commission is as important, if not more important, than the report. We are experts on the commission. We know technically we can produce a Lancet report. That's not what I'm worried about. For me, it's the integrity of the process, it's the dignity in the process, and it's for everyone involved as well. And I center the idea of dignity a lot in my consultations and in my methodology, because for me to come in, for example, talking to sex workers and decriminalization and why that's important to them. And if I want to center their dignity, I need to know what that is, because that's you self-define what dignity is for you. No one can impose what that is. And it's for me to then respect what are the emerging urgent issues for you, and they may completely be different from what I thought they would be or what the statistics say it should be. And I think it's that respect and humility that's required for the process that's really, really important. And I like the theatre. I used to do speech and drama at school, believe it or not, as one of my major subjects. So I really believe a lot in theatre and arts. And one of the planned forums we have in May in Cape Town will be bringing together a group of women who are sex workers in Cape Town, who are mothers, who have been supporting themselves and each other through this whole process of sexual and reproductive health rights services and motherhood, and then having children who have a right to live in healthy and safe and sustainable communities. And bringing them around the table with us as the Commission, with the Black Mamas Alliance in America, where they will be talking about the health disparities of Black American women and Black person of color, I don't know, what's that title? Yeah, people of color in the US. And to show that disparities within countries are just as important as disparities between countries. But how you approach the subject, for example, it's not blaming mothers, which is what tends to happen. It's not that knee-jerk reaction of separating families, which is what tends to happen now. So for me, the idea of centering dignity, and the sex workers group have a theatre a piece that they use around, the issues around health and the difficulties that they face. So it's really just fascinating. It feels like we're in a group of great company, just getting the affirmations as well, which are really important for us. Thank you.
I just want to say that anybody who starts their answer by talking about grandmothers are they're my people. Okay, because I start almost everything I do, everything I write, with looking at a picture of my my grandmother, and it's because it keeps me focused on what needs to happen so that somebody like her could have a life that was better than the one that she was given. And I'm so glad to be part of this conversation because you're speaking so much my language and the language that I know that Anita speaks as well. Part of what I hope to do with the race audits in that center is to really give community members, grandmothers, cousins, uncles, a role in understanding first to map out how their community came to look the way it does, and then to come up with solutions that are not sort of brought in from experts from outside, but really speak to what community members themselves need. So part of that is telling the stories of their lives, and then translating what they learned from that into something that can become real and allow their grandchildren and others the kinds of communities and opportunities that they're really entitled to, but you don't get that from so many of the people that we encounter as Black people. So it's I knew it was going to be fun. Anything Derek comes up with is worth listening to. But you touched my heart today, and I'm grateful for that, for all of you.
It's really good to hear all of the insight. And I love what you said, Derek, that we're not starting from a deficit. That's so interesting because you're right. Like we're always supposed to be the victims, right? We're always supposed to be downcast and, struggling. And even though structural racism and discrimination and oppression has been put on so many communities of color, so many women, so many people who don't identify as quote unquote, with a normal binary gender. It's the most interesting thing about that is that the resilience is stronger than ever. And that's really exciting. And, I just had lovely 2 hours with some amazing Georgetown students earlier today. And we talked about, we were talking about global health and law. And we were talking about we were talking specifically about decolonize. I know that's a loaded word, but if you think about coloniality and its intention and what it's created to do, it is to basically replace everything indigenous, right? Replace everything that you own, that your language, replace everything with something quote unquote superior, right? It is like it's like an ocean of white supremacy, and it's intentional and it's designed to be that way. And we were talking about, I hope it's okay, all you students, that I just talk about you guys. One student was speaking about how, when you meet like a Western person and they speak French and German and English, they're like, oh, I'm bilingual or multilingual and, super impressive. But if you meet like an African person who speaks like 4 or 5 languages, right? Like their local languages, they'll say, oh no, I only speak English, you know what I mean? And how so much of the work, one, is within us, right? Is within us, and like us realizing just the excellence and the beauty of our own cultures. But the truth is like, it's very difficult to do that on your own. It's very difficult to, as an individual, like hype yourself up and pretend like everything around you isn't happening. And so I think, you know, when I think of the commission, I think even we saw this in Mexico City when we did the kickoff, the greatest strength that we have and that I believe that we get to lend to others is community, is this collective voice that says like, we validate you. We don't have to do this dissemination in English. We can do this dissemination in the local language because we're working with, we're going to go the extra mile to make sure that we hear you and that we are translating back to you what you said to us, right? And we're making sure that we get it correctly. You know, something that was really interesting today was we were talking about, you know, so many of you all here, your English may not be your first language. And sometimes you're thinking about like a word and it's not translatable into English. It's like, how much do we miss because of that, right? And so I think, you know, the commission, we really have an opportunity to, as purely as possible, relate back what's actually happening around the world and stitch together real policy that affects the locale as well as the global. So I think that's a huge opportunity.
Thank you. So I'm going to ask one last question before we open this up for audience questions, and it actually builds on what actually each of you has said. One of the things that so the question is basically about the idea of global and local. One of the things that we often face is that people who work locally or certainly in the U.S., you know, or can be very U.S.-centric, have a hard time thinking about the U.S. and their work having global implications, or what is the relevance of looking at things outside of the U.S. There are often folks also who work outside of the U.S. who don't see any relevance of their work to the U.S. So but each of you in your own way talked about the importance of looking at local ideas, local issues, and how they may be relevant, or how you connected just implicitly in what you were saying, that there are things, novel ideas, perspectives, insights, strengths, assets that are at local places in, you know, some tucked away part of the world that can have global implications. So the question is simply, how do you think about the relationship between sort of the local and global? And can you give us sort of a concrete example of an insight, approach, or something that may resonate that you've either done locally that you see as relevant for global, or that you've done globally that you could see as potentially applying, say, in the DC area?
I'm always first, sorry. I was going to give a very specific example because I was thinking about the project that we did with the Woodshed, where we had 2 South African artists create a work in response to the death of Emmett Till. So a playwright had created a piece here at Mosaic Theater about the death of Emmett Till, but we brought in 2 South African artists to also respond to the death of Emmett Till. But what was the most amazing thing about their project is that they dealt deeply with grief. They went all the way down to wailing in the piece, to actually doing ritual performances that are based upon their communities and Tembisa Township, about what it feels like to lose your son. And that response impacted the U.S. audiences very differently because we kind of have a reserved approach to grief, you know, like we go and look at the box and pat it and go away. And it allowed both communities to understand a little bit more about how grieving can help to create a better mental state for coping with death for a mother who might have lost a son. And so it kind of touched on both health as well as on cultural concepts, and it was feeding both sides to be able to see the impact on each local community's response to loss of son to police violence, which happens everywhere.
So before you hand the mic over, can you use one other example and talk about Zora?
So Zora is really different. It's a story, actually.
What is the word? Well, give the full.
Zora is a production about my grandmother, and it's also about a woman who is trying to hold down 3 jobs. She's working as a cleaning lady and also running her own business and also renting out homes in her house. And it's by enacting this situation of two people trying to create a woman who looks like a black woman, who of course is the woman who's doing all this multiple sets of labor. The woman just wants to rest. She just wants to be herself, but she's constantly conforming to everyone else's perceptions about what she can be and who she can be. And the piece worked to be in conversation with other Black women to talk about how they survive. How do we carry this kind of daily burden of having these multiple expectations placed on us as we try to survive? And so I think that that was a local manifestation of thinking about how we cope. You can call it resilience, but it's strategy too.
I should have left my global gag for this. But I think an interesting one on the back of that, I'm sorry, I'm an abortion provider, so I tend to be very biased when I make some of these examples, because that's what I know. So the Roe v. Wade, Dobbs case came up at the Supreme Court. And what was interesting about that is that we know there's the saying, and the epidemiologists will agree, in every setting, political, economical, banking, financial, when the US sneezes, the rest of the world catches a cold, right? And we say that like, it's an accepted joke. And I'm like, yeah, but why? Why? And I think a lot of what I see in the global health, especially the intersection of health and law and humanities, is a lot of normalization of this dominance, right, of global north knowledge and expertise and knowledge production. That's at the same time demonizing of indigenous knowledge, community knowledge, and the like. And I'm going to take a little cynic route to answer your question, but what's important is that the fears around what Roe v. Wade would do if it got unturned was that the whole world was going to see these abortion bans because the United States Supreme Court has said no. But what you are actually seeing is a lot of legislation that is progressive around the world that's actually leaving the US behind. And for the first time, I think legislators, lawmakers, policymakers, all of us in global health are in a very interesting position where it's no longer that, because we're from the US, we can say this. We're like, well, actually, no, you can't say that. And it's interesting how a case like that, jurisprudence like that, can enable different conversations. We could have prevented a lot of what has happened, but we're here now. But I think it's also about tracing where the money and how the money flows, because I think that that's very important in how the architecture of global health has become what it has become. A lot of it is under philanthropic visioning, and a lot of it is around crisis. A lot of global health depends on aid for many of the so-called global south countries. And so the question is, are we willing to really have honest conversations about the neo-colonialism, the NGO industrial complex, the fact that philanthropists, billionaires have no business in setting standards for global health or indicators for what is good for humanity in the first place? Those are the conversations that are needed, and they will come from both the US, because that is where the money flows, right? And they will be met with this amazing community-led activism. But where is that space for that combustion to then happen in a way that leads us to particular outcomes? And so we're hoping that the Commission could be that one space. It's only one space amongst many opportunities. If you look at the Uganda example, it's happening in Kenya as well, it's happening in Ghana, it's happening in many other institutions, where you have evangelical organizations from the US have a lot of money. And for decades, they plan decades ahead. When we get grants as feminists to implement, we get them for 3 years, and half of that is reporting. Yeah. These guys are planning for 20 years' time, right? With billions of dollars, educating up to PhD level how to undo the international human rights system, how to undo the UN, how to undermine multilateral systems. And you see it now in the different regions I've spoken about. It's just an example of what's yet to come, where this money is used supposedly as aid to support communities. The education sector is become now the preferred sector because the health sector and the feminists have that on lockdown. But education and the organizing and the idea that educators need to be organizing in a human rights way, in an activist way that the abortionists and the sex workers have, it's not something that's just automatic for that sector. So it's left huge gaps, gaping gaps. And this is where the people are finding space to operate on that continent and advancing values that are harmful, that are anti-human rights. But again, it's about the money. And so the global is definitely important. And I mean, I'll make one cheeky joke, but like, you also get this thing that I'm a doctor in South Africa, but I'm not a global health expert, right? The person who did the MPH, who spent 2 weeks in the Serengeti and 2 weeks in a health facility, in my health facility, comes to DC to be the global health expert of my community. Those are the difficulties that we are dealing with every day, you know? Yeah.
Derek, if I may, I just want to tap on what has been said, especially the new colonialism. We see that with conservative networks, transnational conservative networks all over the world. I've studied that in particular in Latin America as part of my PhD work. But we also see that as part of what we call big food, for instance, or big corporations, extractive industries, and how they go to different countries, usually the countries that have flexible or lax regulatory frameworks, and they try to influence and influence people long term with their marketing, with their sponsorship, and in the end, that is only perpetuating structures of power. So that's part of what we study at the Institute. I just wanted to mention that, and also connected to something that was said earlier, how we see the law often as a source of opportunity, but it's not just that. It's also, as Dr. T mentioned, it's a law as an enabler of violence, as a source of barriers at the same time. So how can we work with that framework, try to level the playing field and disrupt structures of power that are embedded in systems that are historically colonial, and we have seen that in Latin America, in particular. I'm from Argentina, and that's what I'm trying to represent here today. We see that with groups, that particularly during the COVID-19 pandemic, groups that were denied access to services that are open to the general public, mainly because they are not part of the system, or quote-unquote system, so they don't have identity cards, so they can't access COVID treatment and COVID vaccines. So just wanted to kind of bring a bit of the Latin flavor, I would say, to the discussion and share a bit about those experiences.
I'll just add, I was going to give an example of a, you all right? Yeah, I was going to give an example of a Latin American country, actually. So I was talking to a colleague who works in Ecuador, and he was saying that I think in the last 10 years, they've started collecting data on just factors related to indigeneity. And when like the policymakers see the data, like even though everyone knows that the structures were set up 10 years ago, they're like, oh, this is a recent problem. This just started happening. It's like, no, you just started collecting the data. It's not a recent problem. You're just able to uncover the issues. And when he was telling me about this, I was just thinking about like in Nigeria, or, you know, we could talk about Kenya, or places where there's just so much tribalism, but there's not really, you know, like that's what I was saying earlier, like we're talking about racism, but we're also talking about structural discrimination. We're talking about oppression within countries, whatever that looks like. And we're trying to characterize it and trying to articulate it in a way that people can understand, and more importantly, that policymakers can change things based on that. And I'm just thinking about so much of the data that's not collected, right? Like the data that could show that, like, you know, this one entire ethnic group has I think in Africa we have other issues with kind of health information systems in general. But even like, the census, like that does happen in most countries, or the demographic health survey. Like there's just so much that we're not collecting, and that some of that has to do with colonialism, right? Like with the DHS, like what variables get added there? How are we really modifying it to make sure that it reflects the context of the countries that it's being deployed in? But I think that we can learn quite a bit from that. And this is not just about quote unquote the global South. Like France intentionally does not collect data on race and ethnicity, and they're just like, oh, we're all French, but who's getting beat up by the police? You know what I mean? So regularly, exactly. So I think, for me, I'm very interested in kind of like following the data trail. Like you follow the money trail, I'll follow the data trail, and then we'll see what we can. Yeah.
No, so I just want to hand this, we have about 15 minutes left, and I think Andy is going to handle the Q&A from the audience. So I just want to hand this
Yes, so do we have any questions from the audience? Luis here? Okay.
I recognize that both Ngozi and Dr. T are jet lag, but my question's for you. What is the thinking, is the commission thinking right now about mental health interventions specifically for Black and Brown people? And so part of the motivation for my question is something that your predecessor was highlighting a lot, was the predominance of the biopharmaceutical model, which I think you have echoed too. And that is a problem across the board, but it also has some racist and colonial implications too. And you mentioned the arts as an intervention that has an impact too in mental health. And I think we should be thinking about sort of alternative, mental health intervention that are not necessarily this, narrow biopharmaceutical model, and the health system should start to recognize those and maybe even reimburse those type of mental health interventions. So is the commission thinking about that?
Yes, absolutely we are. And we're thinking at it from a policy perspective, but also at the point of care of the rights holder, the kind of care that they're going to experience. But it also requires us to have a conversation about institutionalization, right, around how the mental or psychiatric practice of medicine has been weaponized as well against particular people. So, in one hand, and I've had these experiences with patients around harm reduction, and I've had this with intersex patients who've been violated with, unnecessary medical interventions. It's saying you want me to seek help for the mental health problem created by the system in that system. And so we need to be resourcing in an urgent matter an array of opportunities and options for people. And for me, it's not disconnected, for example, for the issue around why, as a South African, and I support all indigenous communities for the call for having their land back, is because a lot of our cultural, spiritual practices do depend on us having access to that land and to our sacred spaces. And colonization, one of the very first things it did was dislocate us from the land and steal our land, right? And so even just from that perspective, it's not even just a mental health, let's treat major depression differently. It's the underlying determinants. How did we get to all these mental health issues? And so without addressing the causes of why we even have these fourth generation traumas, it's important in the urgent sense to fix the biomedical paradigm, but it's also important to have that other analysis of being anti-racist, anti-colonial, and what it means then for indigenous health systems, what it means then for African health, traditional health systems as well, and the training and the curriculum. Because often you will find, and I do this personally with a few practitioners, where we have a network between the Chinese medicine guys, the African traditional guys, and the Sangomas, right, and myself. And there are moments where I say to my patients, I have done everything I need to do. I think there's a colleague of mine you need to see. They do the same, right? And they say, I think a patient has come in, they're experiencing what they're experiencing, we're sorting this out, but they are also anemic. And all of that. So we have to have that referral system, but that requires respect for the actual science itself. And that's often lacking in the Western type of health systems and in the ways that health systems are designed. So that kind of outcome is still going to depend on individual practitioners, community-led organizations to do the work while we try to change high level where policymakers should be thinking, where money should be flowing, and they should meet in an urgent way, somewhere in between. But yes, the Commission will be doing some of the work that, looking at different intersections as well. I mean, harm reduction as a policy is something that I've supported throughout my mandate. The war on drugs is just a war on people, but we also know it's a war on Black people, right? When we did all the things we did with hemp and marijuana, suddenly they realized there's an industry. Now you can smoke weed all over New York, right? But where are all the Black people who are in prison for smoking the weed? So, yes, we will be, but it will be within that bigger discussion as well. That's also quite political.
Anything else to add, Ngozi? No? Any other questions? Yes.
Okay. No.
Hello everyone, I'm Eunice Mustafa from Sierra Leone. So mostly when we are in Africa, we are just known as Africans. But the minute we cross boundaries and come to the Western world, we get to adopt a different identity or another identity, and we become Blacks, especially in a very diversified country. Sometimes it can be very difficult to adapt from coming from just being an African to having all these identities attached to you. So I want to know, in terms of the work that the Racial Justice Institute is doing, how are you trying to actually bridge the gap between Africans and African Americans?
I think that's a great question, because that's one of the first questions we approached. We felt that we were employed at Georgetown University for being African Americans, and in fact, we're all Afro-Caribbeans, for one thing. And then I think that it's very important for me personally, and I think we've had this discussion, to think about, they call it intersectionality, but it really means that diversity and Blackness is what we've talked a lot. And how can we actually create systems that address that diversity? And I think that we do have to go locally and specifically. Let's just talk about Washington, D.C. Like, there's an area where it's mostly Ethiopian, there's an area where it's mostly Dominican, there's an area where it's mostly Salvadorian. There are Black Peruvians I'm working with right now as a community in one of the performance projects. And so I think that Americans need to be educated about that, because it has to do with what she said about how we're doing our censuses and how we're collecting the data about what makes a black person who happens to live in America, right? And that's a historical problem too. Even when we talk about slavery, the enslaved were 70% from not America, right? 70% were only 30% came to the United States. So I'm hoping that we will be able to articulate and develop programs and projects that can address the diversity within the Black community, as well as the underlying indigeneity, which is also part of the Black community, because you guys have all talked about language. And I think that's a big challenge, and as Diane says, we need to have partnerships across the university in order to be able to address some of those issues.
Early on in our work, early on in our work, we thought about a project that would really get at this, these issues, and I can't remember what it was that sort of drew us away from it, but now and then we come back and we have that conversation, and I think that sometimes you think, we should have done this way back then, why didn't we do it then? But more and more, especially as we begin to sort of talk more with people in DC, understanding what's going on there and what where we might be helpful, there's something that we need to come back to, I think, and that is talking about the very vast range of people of color in DC, and what they have to say. I was in a cab recently. I had a wonderful conversation about this young man who was just talking about his experience, what was different about from his home, from where he grew up and where he is now, and how he thinks about race in that space. And that's a place where I think that we started earlier on, and we should come back to as we.
I mean, it goes back to Derek's question about global and local, right? As I said it in another thing, the local is here and the global is here too.
Thank you. We have another question, Chris.
Thank you all very much for this. Hi, Diane. Amazing forum, and thank you all for the work that you're doing and for bringing this conversation to DC. This has been a very elevated conversation, as we'd expect at Georgetown. But I'd like to bring things sort of down to a very grassroots level. Last night in DC, in Wards 7 and 8, there were over 200 bullets fired. Just one block, 10 people were shot. This is largely like young African-American men. And I'm wondering what tools or frameworks of thought or lenses from your positions you think that we locally should apply to thinking about these sort of challenges. You know, just earlier you mentioned something called fourth generation trauma. I've never heard that before, right? So I'm just wondering, like, you know, what cognitive frameworks and ideas you have from, you know, your lived experience, but also your education and journey that might be helpful in how we think about these challenges locally.
Doing all the talking.
I thought Derek was going.
Yeah. Okay.
Oh, so I can, and then answer, and then I'm going to hand this over to Diane as we close. I think it's approaching it from two levels. So one is recognizing that those factors are clustering within, it's not an accident where that occurred, and that those things tend to happen in those places. So understanding why that risk, those patterns cluster in a particular population means we have to look at it from a macro level and better understand that perspective. We also need to understand it from the perspective of the people, the men in this case, who are experiencing it, who are both victims as well as just involved in it, and the people who are just around in that space, and what are the things that they are trying to do through that. As counterintuitive as that sounds, there's an aim, as a goal to what they're doing. And so how do we understand other ways to help them come up with better strategies to do that? So how do we strike a balance both from an individual and a structural level and bring those pieces together to come up with new strategies? But that means sitting with them, literally, to better understand their perspective and starting with that. And where can we, again, identify strengths despite all those challenges that exist? And what happened and the horrors of what happened, how do you still find those nuggets of strength to anchor a possible solution? So
I would say the race audit thing that Robin's talking about too.
So as we close, let me hand this over to Diane Restrini to close us out.
I just want to say thank everybody for coming. First of all, to thank this panel for an amazing conversation. I took a lot of notes. As you can see, there's a lot of work to be done. And so I just want to thank you all for coming. I also want to thank our partners. I love working with Andy. I want the rest of the team from O'Neill that helped put this together to stand, and so you can give them a round of applause, because this was all. There are things around the room that allow you to sign up for our, here it is, sign up for our newsletter, and we're going to do more of this. But this is the kind of thing that we want to do, is to see these kind of conversations. I took notes on a bunch of different kinds of work that we could do, and I think one of the things that really came home to me is this creating this new model for knowledge, and organizing and systematizing this way of bringing in people that are closest to the harm. And I think that's a great contribution that we can make to this work going forward. So I just want to thank the panelists again. Thank you all for coming. And the last thing I'll say is, now that you know, what are you going to do about it?
There's one hand in the back. I don't know if you have time. She's been raising it a long time.
Hi, I wanted to thank you all for making this possible for people who are not only practitioners of law, but also who are persons who work in the grassroots, on the grassroots level. A lot of the work that I've done personally has been as a participant, but also as a leader with different types of community-based public health programming. So when the doctor talked about that, I really appreciated that there are physicians who are on a global scale, and hopefully more will be doing that in the United States, connecting with communities to derive not just data, but understand that people and their life experiences, as the person said who works with the plays and theater, people's experiences are types of data that's invaluable, that contributes to that. So whether it's from an epidemiological perspective or a legal perspective, that intersection and seeing that they'll have a variety of a plethora of information coming from a variety of sources is quite beneficial. Thank you so much.
I think that's it. Thank you all for coming. It's been wonderful to have you all here.